What is body whispering, and how could it help to clear subconscious blocks and change ingrained physical and behavioural patterns? We get to ask the doctor all about it right now as body whispering advocate and practitioner Dr. Adeela Afiz joins us. Welcome.
Thank you, guys.
Okay, now you're normally with us on the parenting panel because you have a background in youth work and counselling, don't you? But also your essential baby help workshops. But you're a specialist in body whispering. Now, we've been thinking of what is body whispering, and I feel it's going like this to Mike's body, but I'm not sure if that's correct. What exactly is body whispering?
I get great questions about that. What is it that you do? Whisper to the babies, whisper to the bodies. Yeah. But it's about looking at you as a whole, because you are a body, you're a mind, you're a spirit, and you're also made up of the experiences you have, the beliefs that you have, and your environment. So when you have something that starts to go on with you, whether it's a physical or a mental health issue, I think if you just look at that issue on its own, you're limiting your scope for healing. So it's about looking at you as a whole. And after being in practice for years, what I started to recognize is nearly everything has an emotional or a stress component. Okay. Health issues are either caused by underlying stress that's been unresolved or exacerbated by stress.
I would completely agree with that.
And so, and so body whispering is like, our bodies are intuitive. They have a natural sense of how to heal. But we don't listen to the whispers. When it starts to shout, we go, oh, I have a problem.
Right, okay.
But body whispering is about being in tune with and listening to the information your body has to bring you back to really healing at a holistic level.
Although I really like the idea of going like this and whispering.
It's fun, and I do that sometimes.
Positive information. No, you explained that really well. That totally makes sense to me. So what kind of issues do you see?
Everything. I work with a lot of chronic issues, people who've tried everything else and it hasn't changed. So chronic migraines, body pain, stress, anxiety, depression. You know, we have a real issue with that right now in New Zealand. I work with that a lot because it's about really identifying what are the triggers, what's maybe the event or the underlying issue that's caused that to start, and then it becomes this ingrained behavior. Our body thinks it's normal now to respond in a particular way. We want to bring your body back to what's normal, to its natural state of healing.
So what types of things can cause these issues?
Life.
Everything?
Yeah.
Everything.
Unfortunately, well, all of us have experienced things in life, but the things I work with the most, past trauma, past abuse, relationship breakups, really difficult relationships, divorce. It causes a massive physiological strain on our body when we go through a stressful event, and then just trying to get through life is stressful. Yeah. So you don't resolve that big thing that happened, you add on trying to deal with day-to-day living, your resilience goes down, and suddenly your body starts to have a mental health issue, a physical health issue, an emotional health issue. We have to start to look at you as a whole and look at what's causing it.
And I guess for a lot of people too, some of these issues can be ongoing, so actually taking a different approach can actually help. So how hard is it to find the real issue then, Doctor?
Sometimes it's easy because it's a couple of sessions over several weeks and it's great. Other times, especially if you've had something for a really long time, you've got a chronic issue, you have to start to believe that that can change. So it takes longer to get to the core issue. Part of what I really want to do is let people know that there is hope, that there is the ability to change even something you might have had for years and years and years.
And I guess also the thing is that somebody could come to see you and they wouldn't know what their issue necessarily is, or they might think, oh, I've got my gut's been a bit sore, but they don't understand that there's maybe something else going on that's triggered that.
Yeah, and gut issues are so huge, Mel, but also the gut and the brain are really closely related for those people that suffer with any type of gut stuff. Anxiety is often a huge underlying cause.
Do you do the laying, healing hands thing? Can you explain a bit more about that?
Yeah, so healing hands, whether you're a hands-on practitioner or whether you're a talk therapist, or I run body whispering classes as well all over the world, and it's about teaching people that your body is meant to heal, but we get taught that the answer's on the outside. A doctor has the answer, it's in a pill, it's in a supplement. Let's get back to the body's natural ability to heal. We facilitate that. And I teach other practitioners, but anyone that wants to learn how to just get back into trusting yourself, following the information from your body and starting that process.
Because we do ignore them, don't we?
Well, no, that makes sense, doesn't it?
Well,
We
it
do
does.
ignore them.
But we do, and you're right. We ignore those little whispers of like, oh, it's a bit, that's fine now.
Maybe,
But
yeah.
it's not until a big alarm goes clanging off or something breaks that we actually go, oh, hang on, we've got something to deal with here.
Yeah.
Give me a pill.
Yeah, and you want a quick fix. And it's also really distressing, though, when it gets really bad and you get to a point where the doctor can't help you, the pills aren't working, you start to think, I can't change this
No
anymore.
one knows what's quite wrong.
You start to feel really helpless and hopeless. And that's where I like to come in and say, actually, there's hope and we can change this.
And how has the medical world around the world responded to this?
I think we're starting to all get to that place. Doctors are talking about, all of our professions are talking about stress and diet, right? I think it's just one step beyond that again. Environment is huge, and just to throw a big scientific term out there, but epigenetics is how our genes are responding to our environment more than what we're programmed to. So we want to start to take on the latest scientific research and look at how much environment and stress impacts our health.
Do you have a really memorable client, somebody who's really benefited from what you've done, and how's that worked?
Yeah, so many. I work with a lot of kids as well. And so I know a couple of months ago I started seeing a little girl, she's 12. She was missing more than half her week of school because of tummy aches. She's seen all the doctors, all the specialists. She is now back to school 5 days a week, back to her after school activities, no more tummy aches.
Wow.
I see her once a month for maintenance, but it was about recognising for her what was causing that stress and anxiety, which creates a very physiological response.
It does, particularly in kids. Oh, my tummy ache, you know something else is going on. Well, that's fascinating. We could
Well,
talk
that's very fascinating.
a long
Thank
time
you.
about this. Thank you so much.
My pleasure.